Hello, this is Mike Van Meter. Welcome to the Recovery is Possible, Hope and Healing with Mike and Lillie podcast. We want to thank you for joining us. You can reach us at our Facebook site, which is also called Recovery is Possible, or our website, which is vanmeterwellnesssolutions.com. This podcast exists to educate the public about addiction, remove the stigma associated with addiction, and offer help and support for those suffering from addiction. Hey everybody, this is Mike Van Meter, and I am here with Lillie Van Meter, and this is a Recovery is Possible, Hope and Healing with Mike and Lillie podcast. And tonight, what we want to talk about is the stigma associated with medically assisted treatment and the misconceptions about MAT, because medically assisted treatment is also known as MAT, and those of you in recovery have probably heard that, and those of you going into recovery are going to hear about it. And tonight, well, we're going to talk about what MAT is, and we're going to talk about the common myths and misconceptions about it, and then we're going to address the stigma around MAT and how. And then finally, we're going to address how recovery is possible with Matt. And we're going to just give our thoughts on this, because this is something that we run into quite a bit in recovery circles. This idea of, people just having a problem with using medication to get off of a medication, whether it be alcohol or cocaine or methamphetamine or fentanyl, heroin, all these different types of drugs, because you hear this quite a bit. Hey, Mike, isn't it a problem that I'm using pills to get off of what brought me in? I mean, isn't it the fact that drugs were my problems in the first place? Yes. We are going to address this, and it's important to do so because there are so many misconceptions about this, and I want to address those tonight. But first, before we go into this conversation, what I want to say is we are not going into an in-depth scientific and physiological discussion as to what all of these various drugs are. In fact, we're not going into all of the drugs that are out there. We're just giving you some examples of what's available and how they help. And we can do a deeper dive into the actual medications themselves on other episodes, or you can look them up yourself. But most importantly, talk to your doctor about that, because I am not a doctor. Lillie is not a doctor. The purpose of this podcast is to talk about the stigma associated with medically assisted treatment and how medically assisted treatment can help you, right? But the specifics behind that will work for you. You need to talk to your doctor about. So we're really focused on the stigma tonight, and really encouraging you to get all of the help that you can, because recovery is really a holistic approach, not just one thing. It's just not just one of the elements that we talk about. It's you putting all of the elements together, and medically assisted treatment is just one of them. So I hope I've cleared that up. But before we start, I want to just have Lillie come on for a second and just say a few words, and then we're going to go and we're going to discuss what MAT is. So Lillie, welcome to the show.
Hey, thanks for having me, Mike. Mike and I were thinking about what should we talk about today, and one of the things that was brought up when we were thinking about stigma is this notion that for those who want to go into recovery or have been in recovery or want to go into recovery and their family members want them to go into recovery, this idea of there's a stigma that exists not only within the addict themselves, but the family members as well. It's like, oh, why are you taking another medication to come off another, medication, or even the member themselves? So there's a lot of discussions about it, controversy about it. So Mike and I thought that it would be good for today to talk about what are those stigmas that exist out there, some of them that are fact versus fiction, some myths that are out there, and to kind of quell some of those, so that for those of you who want your loved one or you yourself want to go into recovery, you're going into it with eyes open, so you know what are the issues that are surrounding that, so that you can get the best care that you can get for yourself and for your family members.
Yeah, absolutely. And so as we begin the discussion as to what medically assisted treatment is, and I'm going to keep referring to it as MAT. So I hope you understand that medically assisted treatment, MAT. So first and foremost, this is something that is done with a doctor. Now, the reason why I want to emphasize that is because addiction is the only disease, when you come into a hospital or a treatment facility, it is the only disease where the patient thinks that they know better than the medical professionals on. I see it every single day in the detox unit in the treatment center where I worked before I went to the detox unit. Imagine this. Imagine if you were a cancer patient and you went into a cancer ward and the doctor told you that you had stage 3 cancer and you said, "No, I don't." And the doctor says, "What do you mean you don't?" And you say, "I don't think I have stage 3 cancer." And the doctor says, "Well, I don't really care what you think. You have stage 3 cancer." And you're like, "No, I don't." And the doctor says, "Well, why do you say that?" And you say, "Well, I was on the internet and I was looking up information and I'm convinced I don't." And then you continue to get questioned. You say, "Well, I was talking to my buddy out here in the waiting room and my buddy over here said that I don't have cancer." Or this, I had a family member that said they don't think that I have cancer. And if you were listening to this patient in a hospital, you would think that they were crazy. You'd be like, "Listen, you didn't go to medical school. You didn't do the tests. The doctor says you have cancer. I think you might want to do what the doctor says." I mean, of course, that's what you would do. And that's true of cancer or diabetes or really any problem that took you into the hospital. But every scenario that I just gave you is actually a conversation that I have had with patients every single week. In fact, we have patients that come into the unit and they start dictating to the nurses and to the doctors even what they should be given, when they should be given this, and the amounts they should be given. If you heard these conversations, you would think, what in the world? What are these people doing? And so first and foremost, as we begin this discussion, I want you to understand that medically assisted treatment is done in a medical setting with a doctor, and the patient must take the medications as prescribed. And that's a very, very important thing. And for we addicts, that's actually quite a hard thing to do. Now, that is important because if you're not following the instructions, then medically assisted treatment is useless, certainly not helpful. But what is it? Really what medically assisted treatment is, it's helping people in early recovery deal with the cravings and the urges that they have, the compulsions that they have in early recovery. It's important to understand that no matter what you're using, it could be alcohol, it could be heroin, it could be fentanyl, it could be xylazine, it could be methamphetamine, you name it, cocaine, everything. You're doing a lot of damage to your body, to your brain, the neural pathways, and in fact, in some cases, particularly with alcohol, there's certain vitamins and minerals that are not even absorbed into your body. And all of this has to be repaired, and it has to be done over a period of time. It takes quite a while, actually. I mean, when you're talking about alcohol, for example, it may be a year to a year and a half before all the things I just mentioned kind of reestablish themselves and your brain is functioning properly. With some of the other drugs, and again, just for the sake of time, I cannot go through every single drug that we're talking about, but some of them take quite a while. For example, benzodiazepines take a very long time for the healing to take place. But the various medications that you're given help you in the early stages of recovery. Very much so. It helps you calm down, deal with the anxiety, actually control the urges that you have. And some of these drugs you may have to take for a very, very long time. And in some cases, you maybe even have to do this for the rest of your life when it comes to Suboxone, Subutex, methadone, and things like that. But what's the alternative? The alternative is that you continue using drugs that are destroying your life. And so I will just share with you my own personal example, and I'll turn it over to Lillie and let you know what her take on that was. In my case, it was alcohol. So what was I taking? I was taking Antabuse, which, if you're not familiar with hand abuse, it's the drug that if you drink on it, you're going to really wish that you had not done that very, very quickly. It's the drug that makes you feel very ill once you drink it. And it's kind of like the nuclear attack. It's the drug that really just kind of zaps you and says, okay, that's not a bad idea. It's kind of a safety mechanism. And so that was, I drink and then this makes me stop and not do it again. Okay, I was also on GABA and I was also on Campril. And what that means, those particular drugs, what they do is they work with the centers of your brain that deal with calmness. They help your brain settle down. They help deal with anxiety, which is very, very common, a common reason for people to relapse in very, very early recovery. And this combination of drugs, again, you'd have to talk to your provider to see what's right for you. These drugs helped me through that first year. And in fact, I will credit much of my sobriety to being on these drugs because in that first year, there's just so much anxiety, so much stress, and I needed, and my body had been depleted of vitamins and minerals and serotonin levels, which has to do with calmness and a feeling of wellness. It just had to be balanced out, and these drugs help us do that. And if you're going to relapse, it's likely going to be in that first year to year and a half, and that's where you need that help. Now we'll talk about some of the other drugs too, but Lillie, I'll just turn it over to you for a second. You remember that period when I'm talking about early recovery, I'm talking about this run in recovery because I did not do those things in the other attempts. I mean, what was sort of your experience with me when you were witnessing that whole process?
So, Mike, if I remember, when you finally decided to go into long-term sobriety, I remember that it was on a Friday, and we had seen the addictions doctor, and he had said, "Hey, just come back on a Monday," I think it was. And so you had just gotten done with the detox, and then had come out, if I remember correctly, and he said, "Hey, let me see you that Monday." Right? Because we were thinking about, actually, I think I'm getting the days and times that were incorrect, but there was a particular Friday I remember, and then the doctor had said, come in on that Monday. And so that whole weekend, you didn't drink, you didn't do anything. And so by the time we went to see the doctor, he had said, hey, before I see you, I want you to go to the nearby, like it was a place that you had to take blood work. He wanted to see what your blood work looked like. And so I remember going there before we went to see the doctor. And so, of course, by the time we were waiting to see him, you were just a wreck. I mean, you were shaking. You were definitely experiencing the delirium. What do you call those?
Tremens, the DTs, delirium
right.
tremens.
So you were definitely, I mean, you could even sign your name. So I had to be the one to sign your name. And I was just really scared for you because you were shaking and you were very...
It's very dangerous, actually.
Yep,
you can have a stroke, seizure, or heart attack. Yep.
Yeah, so you're very pale. And then so when we finally saw the doctor on Monday, he even asked you the question. He's like, did you not drink over the weekend? And you had said no. And he's like, wow, Michael, that was actually very dangerous for you to do that, because he could see the condition that you were in.
But we didn't know that, yeah.
We didn't know that at the time. But when we were there with him, I was there as well. And yeah, you had not come out of detox. You had been out, you had relapsed. We had gone back to see this doctor. And so I remember him saying that, hey, in order for you to do this medically, right, in a safe way, he had said, we had agreed that you didn't need to go back to detox, and that we were going to do basically an at-home detox, right? He gave me medications that you were going to take, and then he also prescribed to you, I remember at that time, the Gamma and the Campril, and he had explained that these were medications that were based on the blood work that you, the findings from the blood work that you had. He felt that these medications were for you necessary in order to get your brain levels back to where they needed to be. Mm-hmm. He had explained that they had been depleted in certain areas. And so like when Mike was saying, hey, talk to your doctor because each person's different. And from your blood work, the doctor can determine what's lacking. So I do remember coming home, and he had given me clear instructions on what you could take. And then it was around that time that you had never had that before. And then that's really basically when you were on the road to long-term sobriety.
Mm-hmm. And when we talk about the patient thinking that they know better than the doctor, I remember my doctor saying, we're going to do this for a year. That combination of drugs, we're going to do this for a year. And I remember about 6 months in telling the doctor that I felt fine. I felt like I could go off the drugs. And he said, when we started this journey, I told you you were going to be on this for a year. He said, I don't really care how you think you feel. You're going to have to trust me. You're going to have to trust the process, and you need to be on this for a year. And that's exactly what I did. And so the key takeaway there is that I finally followed those instructions. And guess what? Here we are over 13 years later. We're here 13 years later, and it worked out. And what I am finding with the patients that I work with right now, those that do not get well, the one common trait that they all have is they do not follow the instructions as prescribed because they think that they know better. Even though you have a patient that may be on their 40th or more treatment episode, they still think that they know better. And this goes back to a previous episode where we discussed how addiction is the only disease that tells you that you don't have it. And even when you finally do admit that you have it, you downplay the severity of it. And I don't think that people are lying. I think that's the brain. That's part of addiction. That's part of the brain telling you that it knows better. So that was my particular case. Now, as I mentioned, I did use antabuse, which is the sort of nuclear attack of the drug out there. And that's you drink and you're going to wish that you hadn't. Now, there's a couple of other drugs that are out there that are used for both alcohol and for opiates. And I'll discuss those here in a second. But Lillie wants to chime in and add one other thing.
So, Michael, just for clarification, I'm sure that folks can look up antabuse, but I know from my own experience from you taking it, what it does is that it causes your body to not process the alcohol. It causes your body to process the alcohol differently. So then it creates a outward manifestation where, number one, you go beet red, but then also it just makes you it just makes you very
takes you to
sick.
toxic levels. And again, and I don't want to get too deep into the physiology behind this because there's a scientific explanation for it. And again, you can look that up. But just for the sake of time of this podcast, that just know that it takes you to toxic levels very, very quickly. And that's what makes you feel ill. Now, there's a tendency these days to not prescribe this because of the fact that I think as a society, we're kind of moving towards the softer, gentler way of doing things, which I don't know is always a good thing. Because I can tell you this, the softer, gentler way didn't work for me. It was, I needed the shock. And it worked. Now, but if you do want the softer, gentler way, then you do have a couple of other options that are used for both opiates and for alcohol, okay? And that is naltrexone and Vivitrol. Now, those are basically the same drugs, okay? One's in pill form that you take every day, and then the other one is a shot that you get generally once a month. Okay, so what is that? They are known as a opiate uptake inhibitor. Now, I know I'm saying opiates, but the alcohol, when alcohol is processed, you're using the same receptors as opiates. And so these opiate uptake inhibitors, what this means is that it inhibits the effects of the drug on your body. Now, notice, I didn't say that it eliminates. I said it inhibits. And so just so you can visualize this in your mind, just sort of the sort of the quick way to describe this, simplified way of describing this is, let's say if you drink, you drink and you get 100% effect of alcohol or fentanyl, heroin, whatever you use, you get that full effect. On naltrexone and Vivitrol, it's going to reduce it. It may be 70%, okay, reduced or less. Okay, I'm giving you a guesstimate there. It's going to be a lesser amount than the 100%. Okay, which is good. You're not going to get the euphoric effect that you would take would get if you just drank alcohol or used the drug, if that makes sense. But because it's not 100%, herein lies the danger. And the problem with us addicts is that it's not the 100th drink that kills you. We say that in the AA world. It's the first drink that kills you. And the problem is once that sort of chain of events has started, once that train starts moving, it is really hard to stop. And even though you might only get, let's say, 30% of that euphoric effect, it's still 30% of that euphoric effect, and you're going to chase that. You're going to start chasing that. And the problem is you will try to get to that 100% effect, but you've got this inhibitor in there. And that actually makes it dangerous. So for those of you that are using on either naltrexone or Vivitrol, your healthcare provider will tell you to immediately cease using it. Why? Because that chase that you're going to have, that chase for that high, now is very, very dangerous. Ultimately, you may end up using a lot more of the substance than you would have otherwise. And remember, even though you're not getting the euphoric effect, the dangerous aspects of those drugs are still impacting you. You're just not feeling it. So that's why it's dangerous. Now, that seems to be the drugs that people like to prescribe these days the most. I mean, I see it all the time at the hospital. I've never understood that, actually, particularly for alcohol. Antabuse worked for me. But a lot of patients will come in and they'll say, oh, well, I don't want to take it because, I don't want to replace one drug with another, or I don't like the side effects. There are no side effects. If you don't drink on Antabuse, there's no, or rarely are there side effects to it. It's not affecting your sex drive. That's a common one that we hear. It's not making you drowsy. It's not doing, you don't even know that you're on Antabuse because, you don't feel it. You don't feel anything unless you drink. And in fact, I will share this with you that I actually did drink on it one time. And maybe, Lillie, you can share that story because my last drink 13 years ago was on Antabuse. Do you remember that? How did that work out? So Lillie may remember my last drink. And that last drink was in the house. And like most alcoholics, I'm trying to slip alcohol into my body without my wife knowing about it, as if they don't know about it. And I'd been on Antabuse because being an alcoholic and you don't feel, because I'm not feeling any effects while I'm taking Antabuse. So clearly in my mind, it must not be working. So I'm in bed, I slip a beer, Lillie comes into the bedroom and she looks at me and she says, "You've been drinking, haven't you?" I said, "No. What makes you think that?" And she says, "Come here, look in the mirror." And I look in the mirror, and my face was as red as a lobster. And she said, "You're going to have a rough night." And I did. And that was the last drink that I ever had. So I didn't even get to enjoy the beer. I didn't even have a good time. And that was actually the night leading into our wedding anniversary. And so the interesting thing is my wedding anniversary and my sobriety date are the same day. We didn't plan for it to be that way, but that's the way that it was. But do you remember that, Lillie?
I do. But what was interesting, Mike, I want to ask you a question is, that was the last time that you drank on Antabuse, but you had drank on it before. What was the difference between this last time versus the couple of other times that you had done it where you were on Antabuse and you drank on it? Was there something that was different the last time?
Not really. It was just the times I drank on it before then, I just, the pull was so hard, I just kind of overwhelmed the Antabuse. Remember I was just talking about how, with naltrexone and Vivitrol, it's an inhibitor. But with Antabuse, in my particular case, it didn't make me vomit. It didn't make me so violently ill that I couldn't drink on it. I still did. I felt like crap, but I was drinking enormous amounts because I was having to sort of overcome the Antabuse. But it was making me sick. And also, it was really changing my body's ability to process alcohol. So the effects of the alcohol would last seemingly for days. At least that's what I felt. And it really expedited things because I remember if I drank on it, I would have to call out from work maybe 2 or 3 days after that. And I did. So maybe that was not sustainable.
Okay, but maybe collectively, each time you drank on it, it's like don't put your finger in the socket. So
Yeah.
you had bad experiences with it at least 2 other times that it was enough to say, okay, I'm done.
Yeah. Yeah, it was. But that shows you the power. That shows you the power of the urge from alcohol to stop. But I will tell you that for me, what it was showing was I had an absolute desire to stop because I was taking these steps. You know, I was going with you, I was going to the doctor, I was taking the medication, but the urges were still there. That just shows you how sick I was at the time. But what all of you need to understand was, look at how hard I was working, and I was still relapsing while taking this medication. That shows you how difficult it is. And that's why I say over and over and over again, if you've not made the decision that you want to stop, and you don't keep plugging away, you don't keep working, and you don't absolutely are on fire to get well, you're not going to get well. Because I was by that point, and this was still happening. But I didn't give up. I kept coming back. And here we are today to talk about it. But I also had your support, which was helpful. And, unfortunately, a lot of people that I work with, their families are long gone. They don't have support at home. If I was living at home by myself, I really don't know how much success I would have had. I really don't.
Yeah. And that's a shame of it, right? Because I think that by the time, unfortunately, like you said, the addict comes to their senses where they really want to and are willing to go through all steps to be able to get well. Excuse me. They, the family members sometimes give out before they do.
Mm-hmm. Yeah. And I'll tell you, it really doesn't help too. I want to kind of pivot a little bit in this discussion to the stigma itself. Because not only do you have these issues going on, the patients trying to play doctor themselves, then the commitment of staying with Matt, maybe they have their own preconceived notions of it. But then you have let's start with this, because I want to talk about recovery meetings, and then I want to talk about the larger society. But let's start with recovery meetings, because I was subject to this as well too. And I want to be very delicate when I talk about this, because in the recovery world, this whole part of the discussion can be a subject for very hot debate and lots of emotion. It is true that in a lot of recovery groups, there are people that believe that you should not be taking any medication whatsoever for any reason. And if you're taking medication, then you're not truly in recovery. Now, I've been to those meetings. I had heard that myself. I don't know that I ever believed that in the first place, because, when you read recovery meeting histories, particularly AA history, you'll find that Bill Wilson and Dr. Bob Smith were very open to any sort of modality that helped. Their mission was to get people sober. That's what it was. And they were very open to all kinds of modalities, whether it was niacin, they experimented with that. Bill Wilson even experimented with marijuana and LSD for a while. He actually got away from that very, very quickly because he recognized the danger. And also, they didn't have the information at that time that we have now. But he believed that you should bring psychologists and psychiatrists and clergy in and all these different things. So he was very open to these types of things. So the people that say that, it was just the 12 steps and it was complete abstinence is true. But what he wasn't saying that in fact, Bill Wilson talked about utilizing doctors, that God gave us doctors and gave us the information that they had to help us, and we should rely upon that. Now, when you are new to recovery meetings, you do need to understand that working with a therapist, working with a psychiatrist, with psychologist, or a medical doctor, and working with someone in a 12-step group is not the same thing, and they serve different purposes. Okay? When you go to a recovery meeting, this is one alcoholic or one addict working with another alcoholic and addict. They are not your doctor. They may have very strong opinions about what they've done in their own recovery, but that's the purpose of a recovery meeting. Somebody is telling you what they have done to get sober, but you are not them. The only thing that you should take away from them is, hey, I don't drink and I don't drug, period. I don't pick up for any reason at all. I do not pick up that first drink or drug, okay? But from there, the discussion beyond that point is they're helping you to develop a way to live life on life's terms. And they're sharing with you how they have learned to live life on life's terms. And if this particular individual decided that they weren't going to put any drug for any reason into their body and they were able to get into long-term sobriety, then God bless them. That's fantastic. That is awesome. But that may not be your journey, because I'm going to tell you right now, that was not my journey. That was not my journey. Medically assisted treatment helped me along the way. In fact, I probably wouldn't be here today without that. And when you get into the synthetic drugs, you get into fentanyl, you get into xylazine, you get into heroin, you get into all the things that are, and there's even worse things coming down the pike. These things are very serious. They are benzodiazepines, highly addictive, levels that are beyond even what I can imagine, because I'm here for alcohol. You know, I was never hooked on benzodiazepines or fentanyl or xylazine. You know, some of these drugs can help people stop using these drugs and stop dying. And so we have to be careful. Now, it is incumbent upon the person coming into recovery to understand this difference, because you can go into a meeting and somebody can shame you in this. But you have to understand the history. You have to understand what they're talking. You have to understand what that person's role is, and more importantly, what it is not. Okay? And I'll be honest with you, if I can give somebody a piece of advice, that is, if you're working with a doctor and they're prescribing some of these medications to you, and you go into an AA or an NA meeting, I don't know that I would really advertise that I'm using these drugs, because it's really nobody's business anyway. If what brought you to an AA meeting was alcohol, that's why you're there. And if you're not drinking and this is helping you not drink, well, then just leave it at that. That would be my advice. Just keep that to yourself. And if you are somebody that's in an AA meeting and you have somebody that you're working with, understand you are not a doctor. And when you get to the point to where you start telling an individual you've met in an AA meeting that they should or should not be using a medication, you need to ask yourself, are you qualified to be telling them that? Because I don't tell people that, and I work in a detox facility. So go ahead, Lily.
So what I was going to say, Mike, is whether it's AA or Al-Anon, those are support groups, right? Support groups, and they're not professional, they're not medical, and so the folks in those meetings should not be providing medical advice. And you're supposed to be providing support to somebody, not trying to override what a doctor says. Now, having said that, if you don't necessarily agree with that doctor, then go to another doctor. There's a lot of doctors in the area, right? Just like if you were sick with cancer or in any other disease, you would say, hey, get a second opinion. But the second opinion shouldn't be Joe Blow off the street, fellow, alcoholic. If we really think of alcoholism and drug addiction as a medical condition, why would we ask somebody off the street for medical advice? So part of the stigma, like you and I were talking about earlier, is this is a disease that I think, Joe Blow off the street thinks he's an expert, right? But he didn't go to medical school. And so there are some issues, though, as you and I have discussed before, there are some doctors, especially generalists, who they only get one course on addiction. And so you definitely want to be able to work with a doctor who's a specialist in addiction. And so thank goodness in your particular case, the psychiatrist that you were working with, who understood and understands addiction, I wholeheartely trusted what he was advising us.
Yeah, well, he's an addiction specialist. And as you just mentioned, these people, a lot of doctors, unless they're an addiction specialist, it may be that they got no more than 2 or 3 hours of training on addiction in their entire medical school experience. And the other thing, too, as you just mentioned, these are support groups. they are support groups. And because you're working with someone that's helping you live your life on life's terms and not relapse, they may not understand also that you have a lot of other underlying issues. It may be that you're bipolar. It may be that you're schizophrenic. It may be that you have traumatic brain injury. I mean, I could go through a whole laundry list of different conditions that patients have in addition to their addiction. And you may be taking medications for your schizophrenia, for your bipolar, or even diabetes and things like that. I mean, I have met people in recovery meetings that are so extreme with this. It is like literally, you should be putting no pills or medicines into your body, period. Well, that's very dangerous if you're talking to somebody that's on a statin. What about cholesterol medication? If I take a statin, does that mean I'm not in recovery? Really? If I'm taking medication for diabetes or for schizophrenia or any other sort of depression, things like that, these people are not qualified to be giving you that advice. Okay? Period. You need to understand that. And that's why I'm saying be very careful in the discussions that you have with people. Understand what their role is. Now, that's not a slam on anyone. I'm a big 12-step guy, as you know, Lily. I'm a big 12-step guy. But I also understand what a recovery and support group is. It is that. It is a support group. And for that, it's excellent. I really think that because if you think about it, when people go out and relapse, if I was to relapse tonight, it would be because something significant in my life would occur. Something just so emotionally overwhelming that it would take me out and make me think that having a drink or a drug would be a good choice, a good thing to do. And when you look at the 12 steps, alcohol and drugs are only mentioned in the first step. They're never mentioned again after that. The rest of the steps are geared towards you learning to live life on life's terms. Okay, but we are all individuals. We all have various problems that are going on, and not just emotional problems, not just psychological problems, but sometimes medical problems as well. And with that, you want to go to the people that are qualified to do so. But you raised a good point, and that is, do understand that when it comes to addiction, you need to find that specialist, because just because somebody has doctor in front of their name does not necessarily mean that they know a whole lot about addiction. You and I actually experienced that, didn't we? Mm-hmm. I know before we met the doctor that you discussed earlier, who is an addiction specialist, we had some pretty bad experiences, didn't we?
We did. There was one particular person that you were seeing that he was so expensive and he wasn't in network. So I spent, after about $1,000, I was like, I don't really feel that you're getting anything out of this. So, and then later on, when you found the doctor that really helped us, it was like night and day. And so you really do have to find, just like you would go look for any other doctor, especially one who specializes in addiction, there are good ones and there are not so good ones as well.
Mm-hmm. Yeah. I remember early on, I remember the first doctor who was just a family practitioner. I mentioned, this is the first time I ever mentioned anyone, I think I have a drinking problem. Oh, okay. Well, what do you drink? Tell me about it. And I remember telling him that my drink of choice at the time was red wine. And I actually told him that was the first time I was actually honest about the amount of red wine that I was drinking. I remember him saying to me, well, red wine's good for you. It's got health benefits. Just cut back a little bit. And I'm looking at this guy going, did you hear what I just said? There is no way you're telling me that red wine is healthy in the amounts that I'm telling you that I'm drinking. My friend, this is not a matter of me cutting back a little bit. Did you hear what I told you? And that I knew right there. And even then, in those early days, I was like, this guy has no idea what he's talking about. You really do need to get an addiction specialist. You do. You need to listen, there's so many people around you. If you're somebody that's listening to this right now and you're struggling, there are people around you that have traveled this road, and take their advice. But that's going to be the important part. Not just listen to their advice, but take their advice and put it into action. Because it wasn't until I put it into action that I had any modicum of success. But in my story, the one that I just told you here earlier, understand that I didn't stop because I hit a roadblock. I will say that was probably the most important part of my recovery, is I just never gave up. And that's most of us addicts are hard-headed and stubborn, that can be a detriment. It can also be an asset if you channel it the right way. And I just became stubborn in a way where I'm like, damn it, I'm going to do this. I'm going to do it no matter what. And I just committed myself to it and gave myself that year was that target. It was like, I'm going to give this 12 months and let's just see how things go. And I did do that.
Well, Mike, when you're in your meetings, do you guys have, take what you like, leave the rest? So like you were saying, you take the program, you find out who those winners are that resonate with you, right? If there was somebody who would say, Mike, don't take any medications at all, that would not sit well. I mean, if that person was telling you, you probably would not be in recovery today. But I know that in our meetings, like in our Al-Anon meetings, take what you like, leave the rest. If there's somebody that resonates with you, who maybe perhaps you're not following an exact identical path as they did, but it's almost like a mentor, right? We call them sponsors, but like a mentor who's gone before you and they're doing something that you like. And whether or not it was somebody who was traveling a road that was kind of like yours, I know that in my particular case, we don't talk about very specific therapies or doctors. We just say, hey, I talked to my therapist, right? So if someone's seeing a therapist, we don't delve to find out any details about it. But we do know that there are individuals who go see therapists. You're seeing an addiction specialist. So you go to those meetings and you take what works for you, but you leave the professional treatment doctor type stuff out of it, right? Because it's between you and your doctor. But everything else, like we were saying, this disease consumes you mind, body, and spirit. The physical aspect, the body part, leave that between you and your doctor, right? But then the spiritual aspect, the emotional aspect, the support group, as far as we talked about last week about the 3 elements or the 6 boxes about, influencing yourself to change, you yourself, your peers, right? That social pressure and the environment is including the medical profession. As long as you've got it clear in your head, as far as all these influences upon yourself to change, you've got to be in your mind. You've got to be clear in your mind because it's your recovery, right? If you yourself, regardless of me or your doctor or anybody else around you, if you're not determined to get well, then you're just basically going to drink yourself to death.
You're not going to get well. You're not going to get well if you don't. All these people are here to help you. But at the end of the day, the person that puts the drink or the drug into your body is you. I'll just say this right here. If you think that the cavalry is coming, they're not. If you think that going to a meeting, because I hear that all the time. People say, well, I'm working in recovery. What are you doing? Well, I go to meetings. Okay. All right. That's not working a program. What are you waiting on? I'm waiting until my divorce goes through. Then I'll get sober. I'm waiting until I get to that new job. I'm waiting until I get into the new relationship, getting into a relationship, getting out of a relationship, all those different things. And it's like people are waiting for some magic wand to be displayed, and then they'll get well. That's not how it works. But the key to what you just said was you've got to want to get well. It starts with that. Who else is going to make you get well? But all of these things, recovery meetings, medically assisted treatment, your spiritual life, and we'll talk about spiritual life down the road, all of these things work together. It's holistic. It's not any one thing. It's all of these things, is it not? Mm-hmm. Is that not what you saw over the last 13 years? Mm-hmm. I mean, what did you see come together over the last 3? Definitely in the very beginning, it was medical. I mean, I really needed medical assistance in the beginning. That was because you're just holding on for dear life in those early days, weeks, months, even the first year. But then it started to change. Because the thing that fuels my recovery today is I'm not hanging on to the medical part now. I'm not. Because I'm not climbing out of my skin. I'm not up all night, which is a very common thing in early recovery, not being able to sleep because of the depleted serotonin levels, which is due to lack of sleep. So those of you that think that your drinking helps your sleep, it actually doesn't. It does quite the opposite. But what did it bloom into? What other things then started to help?
You mean as far as your recovery?
Yeah.
Well, certainly.
In the beginning, it was medical.
Oh, yeah,
and then
absolutely.
after that.
Yeah, because like you said that you had mentioned earlier in this episode, you said you might have to take it for a long time, right? So in your particular case, the doctor had you take the Campril and the GABA for at least a year. And then he would check you periodically. He would check your blood work, right? So it was under the care of a doctor. And then because you can only focus on so many things at any given time. So initially work on go to meetings, right? Work on getting your levels up. Try to keep things simple so that you can follow it. And then later on, I think what is that thing that you talk about first year, second year, by the time you get to the fifth year, you focus on different things.
Yeah.
So you did follow that formula. I think that it really helped. And so it was your program, Mike. I mean, I know that you're along the way, you would tell me, but I think that by the time you got into long-term recovery, or I knew that I could tell that you were deciding for yourself that you wanted to become well, because there was a marked difference before you went into recovery. It was me trying to determine for you what steps you needed to take. And then once you decided to go into sobriety and to get into recovery, then when we were working with the doctor, we were working together. But all the stuff that you were doing, your meetings, that was just you. So I was able to focus more on myself, on my kids, our kids. And so I really was able to get hands off from you. And so really it's interesting how you say, what did I see? I saw you get better, but I also saw you go into the driver's seat. Mm-hmm. And that was something that I had not seen before you went to recovery.
Mm-hmm. Yeah. And that's, you have to really own it. You really do. Now, talking about society at large, and then we'll wrap up with this. Society at large really has such a disdain for addiction to begin with. And as a result, I think, even those in the larger society will look at this and say, oh my goodness, you stopped drinking, you stopped taking drugs, now you're using this. And that's just another form of drug addiction. And, you can, if they hear you're a methadone or Suboxone or Subutex, particularly those types of things, I think that the larger society really judges that as well. And I've said this before and I'll say it again. I've never seen a disease where people have not just an opinion, but a very strong opinion over something that they know very little to nothing about. And I think that this is where education comes in. And those of us in recovery have an obligation to educate the rest of the public about what's happening and why things are done, and demonstrate that you can get well and you help others get well. And if more of us were open about the work that we're doing to help others get well, I think there would be less of a stigma behind it. Because, Lillie, when I go around the country, and I go around the country and I give presentations on addiction, honestly, I've even places where I'm not talking about addiction. It's a habit of mine now. I just will go, when I was on the political campaign, every single group, no matter what the topic was on that evening, I would ask, how many people in this room know of someone, or you are someone, you work with someone, who in here knows someone that has a serious addiction issue? And do you know that 100% of the room raises their hand? And this is every time I talk. Name one thing in your life where you could ask a room a question like that and get a 100% response. Name one. I can't think of any. I mean, that's how bad it is. But on the flip side of that coin, every single person in that room has a very strong negative opinion about addiction. And to go along with that is how we deal with addiction, particularly if they're on methadone or Suboxone. There seems to be a real stigma associated with that. And I think that the only way that we can get around that is if we do things like you and I are doing right now, where we're talking about it and talking about what a serious disease this is. You wouldn't judge someone that was taking a cancer medication or diabetes medication, or a schizophrenic that's taking. I mean, we want them to be taking these medications because we know that it's giving them a better quality of life, not only for them but for everyone around them. It's only with addiction where we have that sort of stigma. And I do think what I'd like to see is this nation. I would like to see our government do so much more to educate the public on this, because it is a huge health crisis, but the amount of time and money spent on this is not commensurate with the actual size and scope of the problem itself.
Well, I think, Mike, part of that is because, that was one of the biggest reasons why we talked about you getting your master's degree, right? And because there was a lot of erroneous information, right? A lot of stigma, and then just a lot of bad information out there when you and I were researching in order to be able to figure it out ourselves. And so that was what bore this podcast in the first place, right? Was to educate the public with all the things that we had encountered for ourselves. And as you were saying, the stigma is so bad that in a lot of respects, it's a disservice, right? Because we put a lot of shame onto those addicts. And even for me, I was guilty, right? I put a lot of shame on you. But it, like you said, not only is it the only disease that'll tell you you don't have a disease, but the amount of wreckage and pain it causes family members. And like you said, not one person didn't raise their hand. Well, I'm sure every one of those people remember that because it wreaked havoc on their families. And so they see this person drunk, acting disorderly and doing all this stuff and creating problems for the family. So of course they're upset, they're emotional about it, especially if they were raised in an alcoholic home or they had an alcoholic spouse. There's a lot of hurt, a lot of pain. And so with that, there is they're hurt, number one. There is a moral component that goes along with it. And so all of that comes into play on why they try to make the addict or the alcoholic feel very, very guilty.
Yeah, absolutely. It is painful, but that's why I think we need to talk about it. We need to really talk about how this is it's a family disease. It's not just you. This is actually one of the other only diseases also that negatively impacts people in the way that it does. I mean, I understand that cancer and all that, it impacts everybody, but not in quite the same way, because no one blames the cancer patient for causing all of that pain, but we do. And that's actually one of the sources of people, this sounds weird, but sometimes people have a hard time getting sober because they know when they get sober, they're going to have to deal with the damage that was done. And again, that's a very sort of complex and difficult issue to deal with. And maybe we'll do a podcast on the road, because I've actually heard people say, I just know that if I get sober, I'm going to have to go back and clean up all of that damage. And the weird part of this is, so what they do is they stay in the addiction so they don't actually have to go back and deal with it. And that's a complex psychological issue for another time. But a lot of it comes from how the family treats them. This is one of those things where if you have a loved one that got sober, then that should be the greatest thing that's ever happened to you and to them. And this should be celebrated. It really should. It's difficult because the emotions run deep, the hurt runs deep. I'll even put you on the spot and say that, there are times if you and I get into a big argument now, even now, we get into a big argument and you really want to pull out that thing to hurt, you'll bring up the drinking days. Now, it's been 13 years. And I remember saying to you one time, it's like, so when do you get to stop pulling the addiction card? Because 13 years ago, that might have been why we were arguing. But 13 years later, you and I can have arguments about everything under the sun, but we're not arguing about my drinking. So I don't know why that card keeps getting pulled. But that just shows how deep the hurt was, right? It got it. But I think if we all come together and we understand this, and we really, really understand what a complex disease this is and how hard it is to deal with, and be overjoyed when you have a loved one that has gotten sober. You need to understand that loved one that got sober, that's rarefied air. Because I hate to say this, but most people that need to be in recovery will never even attempt to get into recovery. And those that attempt, really only a small portion of them will get into long-term recovery. So if you're in that area where your loved one is in that long-term recovery, that's something that should be treated very or celebrated, because it's just difficult. It really is. And you know that.
Yeah, and like you're saying, it's because there's so much hurt. The family members have been hurt so much that it can be difficult to celebrate the successes of the addict or the alcoholic, right? I mean, that's a natural response. But at the same time, it was when you and I settled. I remember when we first went to AA and Al-Anon, I was like, what do you mean it's a disease? I mean, all he has to do is stop. What's the big deal, right? So that's because there's a misunderstanding.
Was it that easy? You should have told me that.
Well, no, I had told you that many times. Say, if you would just stop.
It was that easy. Yeah, okay.
Right?
All right.
And then it took me many, 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 many years. In fact, 12 years from the first AA meeting that you went to that we realized, wow, this is a lot harder. Yeah. So when they say that it's a disease, it takes a little while to get to a point where you accept the fact that it really is a disease. So when I look back and think about it, remember how we talked about last time, the elephant in the room is the disease, and then you and I are together trying to fight it together. And even today we have to fight it, that the enemy is not ourselves, but it's the disease itself. And so by having that united front and confronting it together, and we could stay objective, saying, okay, it's whatever's happened where it's consuming you, we're like, okay, well, let's pick up the pieces and start up again. And so I know that, let me ask you, when I did that change, that mind shift change, and I started not blaming you anymore, and then we would say, okay, well, let's start up again. How did you feel about that when I started doing that?
I thought it was very helpful. I did, because I felt like I knew that this was at that point, because by the end of my drinking, no one wanted me to get sober more than me. I had fantasies about getting sober. I had these fantasies in my mind of what it would be like to not drink and what my life would be like. And by then, I knew that alcoholism was this thing that was out there. It was almost like a spiritual battle, to be honest. That's just how I look at it. I'm not saying that other people. I'm just giving you my perception of what it was like. And it was almost like I was battling this other person in a way. And it's easier to go to battle with a partner that's helping you, as opposed, like the two of us would gang up on it, as opposed to me fighting it, because I was wounded. So imagine being in a fight with someone and you're wounded, or you're tired, or you're just depleted, and you're just weak in so many ways. And that's how I felt. But I was in this fight for my life against a very strong opponent bigger than me, stronger than me, healthier than me, that was not depleted, that was not tired. And I was. And now I felt like I had a partner in the ring with me, and we're going to team up on this monster. That's kind of how I looked at it. It's this thing that sits on your shoulder that just never goes away. And if you're not an addict, I know what you're thinking. You're thinking that's kind of a crazy way to describe this. But for you addicts that are listening to me right now, you know exactly what I'm talking about. After all, there's a reason why people put a persona on their addiction. It's almost like a divorce. When you get into recovery, people will talk about it as almost like they're divorcing someone. They've left someone. How many times does a spouse say, "You're not married to me. You're married to the bottle, or to the pipe, or to the drug"? That's a very, very, very common. And we personify the addiction And so we need help in that fight against that person. That's really the only way I can describe it. And it's a very powerful opponent. And by the way, even when you get sober, they're waiting for you. There's a very common saying in AA that while you're here in this meeting getting well, your disease is out in the parking lot doing push-ups, getting stronger, waiting to beat you up when you come out in the parking lot. So we always talk about this is like this other opponent. But to wrap up with this, because we're talking about Matt in this, medically assisted treatment, and that's another partner in this. So you're going to have your family, you're going to have your spiritual life, you're going to have the meetings, you're going to have the fellowship, you're going to have other people in recovery, but you're also going to likely have some medically assisted treatment to help you in this battle. And that is an important tool. Many, many, many of us have used Matt to help in the journey. So don't discount it. But once again, I'm going to say that this is something that you need to talk to your doctor about. Lillie and I have talked about a few of the drugs that are available out there, but you must talk to your doctor about that. But what I'm going to tell you, what I am going to say, and I'm going to emphasize this, is any opinions about these medications as they relate to you need to come from your doctor, not from the buddy that you met in a detox unit or in a treatment center. They are not the people to be giving you advice on this kind of stuff. So Lillie, go ahead and take us out on this.
I think this was a very important topic, Mike. I think that especially in your particular case, it was needed, especially the first year. And so I hope that this was a value to those who are listening, understanding, like you were saying, it's a complex disease. It's a combination of family support. It's a combination of the medical profession assisting you. And the most important is you, the addict or the alcoholic who are struggling. We're here to support you. And we want to encourage you as well as your family members and your loved ones who are supporting you to be there for you. And we want you all to succeed.
Yeah. So thank you so much. And again, guys, this is Mike and Lillie. And this is Recovery is Possible, Hope and Healing with Mike and Lillie. And you guys take care of yourselves. And we will see you all next time. And we're going to be trying to be putting this out once a week because there's a lot of information to get out there and a lot of people who need help. So you guys take care. Recovery is possible. And we'll see you soon. So as I always like to say, I do not represent any group, do not represent anyone other than myself. My only purpose in giving this information is to share with you what I've done because it's helped me and maybe it will help you too. If I've said something that does not apply to you or you don't agree with, then just discard it. But try to take any information that you can use for yourself and help others as well. That's what we do in recovery. We help ourselves along the way, and we hope to impart the knowledge we have gained to others as well. With that, please visit our Facebook page, Recovery is Possible, and our website, VanMeterWellnessSolutions.com. Let us know how we're doing, and let us know if there's any topic that you're interested in hearing about. We'd love to hear from you, and take care, and we'll see you next time.